Good evening. Good evening, everyone at home. I hope we are all doing good today. It's our third episode of Insurance Scoop. It's your program where you can find out more about your insurance products, or if you are interested in opening insurance, you can. Obviously, I'm not alone. I am with Mr. Widen Perez, my co-host. Mr. Perez, can you introduce yourself, say hi to our viewers, and introduce our guest for today? Somehow your microphone is off, Mr. Perry. While Mr. Perry is sorting out his microphone.
How about
now we can hear you. Can you please say something?
Sorry about that. Like I was saying, my name is Widen. It's a pleasure being with you again on this third episode of the Insurance Scoop. I want to welcome all our guests and new guests for that matter. Simpiwe, we have an exciting program today.
Definitely, Mr. Perry. Can you please introduce our guests today?
Yes, Simpiwe, today we have United Health Insurance in the house. And the two gentlemen that we'll be talking to today are Mr. Matsebula and Mr. Ngwenya. These are two gentlemen from United Health Insurance. So we'll be talking health today, Simpiwe.
I am excited about today. Let me say so. I am quite excited about today. We have the operations manager from United Health Insurance, one of our subsidiary companies, and we also have Mr. Bongani Ngwenya, who is the case management officer from United Health Insurance. He is a nurse by profession. So yes, we have the best of the best in the house. We are talking about Men's Health Month today. We know men face quite a lot of things as the heads of the family. So these gentlemen today are going to help us understand more about men's health and what they have to offer as United Health Insurance.
Indeed, Simpiwe. I'm not so sure about things, but yeah, men do like women as well, do have some unique problems, health problems that they face as men. And today we'll be discussing that in this week. This is Men's Health Week. Thanks, Simpiwe. But what is on our diary today, Simpiwe?
Wow. We always have something going on. Fortunately, every Thursdays we have our insurance scoop. Please do not ever miss out. If ever you think you might forget, just click that. There should be a bell that will say get notifications whenever United Holdings is going live. Please do join us every Thursday for insurance scoop. Tomorrow we are going live on VOC FM. We are also going to be live here on Facebook. We'll continue talking about Men's Health Month and what we have in offer for you. Of course, our mobile office is always on the road. We will get onto that a bit later on. Otherwise, join us every Thursday, join us every Friday. And every Friday we have the UGI Lab of Lamb at Royal Swazi at Ezulwini. Please do join us if you are a golfer. Thank you, Mr. Perry. Over to you.
Today, that diary was short. I was expecting to relax for the next 5 minutes as usual, but it looks like we have little on our diary.
I listen. One of our viewers said, you know what, just get on to the point and let's talking about so many things. So I am a very good listener.
But I'm sure one of the things our viewers are interested in is the price. We asked a question.
Oh, yes. Today, yes. If you can see my background today, we have let me shift a bit. Yeah, that very nice bag. You can see we are giving it away if you answer today's question correctly. So I hope the gentlemen I'm with, they have the answer. The question for us. Definitely we are giving away every week on our insurance group. We are giving away a prize to the lucky or to the viewer that gets the question correct. Last week we had we were giving away, we had UGI. We are giving away a nice coffee mug, which we are going to show off before the before the end of the week next week, when we are introducing our winner. May I introduce our winner for last week's competition before the end of the show? And please stay tuned so that you can find out, get a clue of the answer before we ask the question.
Oh, yes. So you have to stay on the show until the end to get that question so that you can get the answer, so that you can win the bag. Simpio, I'm envious of our viewers because that bag is really nice. I wish I could.
So nice, really nice.
All right, Simpio, thanks very much for that. Maybe we should get on straight into the business. What do you say?
Yes, please. I do not want to be the one that doesn't listen. Please go straight into the program.
All right, thanks very much. I want to welcome our two gentlemen, our two guests today, Mr. Matsebula and Mr. Ngwenya. My first question, or maybe let me allow the two gentlemen to introduce themselves. Mr. Matsebula, would you like to introduce yourself maybe more fully?
Good evening, Mr. Berry. I am hoping that you can hear me. I'm audible enough.
Please go ahead.
Thank you. Good evening, Mr. Berry and Simpio and Mr. Ngwenya, and also to your viewers at home. We are truly honored today to be part of your program. We look forward to interacting with our clients more in terms of our today's program and today's topic, in which we'll be unpacking our men's health month and the key topics around issues that are affecting men. As I was introduced, I am Lungelo Matsebula. I am working at United Health Insurance, currently serving as the operations manager for that subsidiary. Thank you.
Thank you, Mr. Matsebula. It's a pleasure having you on the show. I'm sure we will be having you sometime later, but today we are going to be speaking men's health. Thank you very much. Mr. Ngwenya, we are so happy to have you on the show.
Thank you so much, Mr. Berry. And evening to our viewers at home. It's very nice to be part of the show today, talking about an interesting topic about issues affecting our health as men. Yes, we have a lady as part of our panel, just to dilute us, but this month is all about us men and the boys out there aspiring to be men. So thank you for bringing me to be part of the show.
Thank you very much, Bongani, Mr. Ngwenya. Thank you. Absolutely a pleasure to have you. And yeah, we have been diluted by one woman, and she calls it a thing. Anyway, let's move on.
The Rosa Mountains.
Okay, let's move on. Maybe my first question, I would like to direct it to Mr. Matsebula. Mr. Matsebula, maybe you could briefly tell us about UHI and its offerings.
Thank you, Mr. Berry. Indeed, UHI is the shortened name for United Health Insurance, which is our medical insurer. We are a subsidiary company of United Holdings, which I am sure your viewers now know that we have 4 subsidiaries under the United Holdings brand. So for us, we are in the United Health Insurance. We are in the space of offering medical insurance to our clients. We do offer a wide range of covers that our clients can enjoy in terms of access to hospitals and pharmacies and clinics. Our covers, we've made them to be affordable and accessible to our clients. We do offer both inpatient and outpatient benefits. depending on the client's needs in terms of the cover that they would want. We always advise that the client should not look at how much it will cost them to get that particular cover, but they should actually look at their health needs before they can actually choose a cover. We do have our consultants across the country in our various branches where our clients should be able to interact with the client and be able to speak to them about their health conditions. They've been trained how to treat that information. So our clients should be free to interact with the consultants in our branches and to be able to have them advise them of a suitable plan that they should take in terms of in regards to their health needs. So we do have a wide range of covers that our clients will access. Like I said, they are very affordable and they are very accessible in terms of the usage, because we can make the plan very affordable, but you find that when it's time for you to utilize it, you are unable to get adequate service that you require. So we have made sure that we make both our plans affordable and accessible. Our cards can be used across the various hospitals that we have in the country, including your semi-private hospitals like your RFM and Good Shepherd. I know that some of our clients, they would always say that they still want to visit those particular hospitals. So we have also ensured that they can be able to access those hospitals, especially in the private OPD, where they will be serviced from there. All the other top hospitals, in terms of the private facilities, they'll be able also to utilize those facilities using our card. So you don't have to be paying any cash at the hospital. You just produce your United Health Insurance membership card together with your national identity card, and they should be able to assist you from there without you having to fork out money. In such a time whereby you find that the cash flows are not very good on all of us because of the COVID-19 strains, we've had to find ourselves changing our shopping list to include a mask, to include sanitizer, to include ginger, to include lemon, So you find that now there is too much cash constraints. So that is why we always say you must have our covers so that you are able to utilize them and not have to always pay cash, because out-of-pocket healthcare has proven to be very costly for everyone. So that's why we have then said clients must come and take covers with us, and they'll be able to be assisted with ease, Mr. Bear. I think your mic is on mute, sir.
Today, Mr. Mathebula, I hope I'm going to get back into form. I was just saying, yes, you're quite right. You mentioned there that out-of-pocket healthcare is quite expensive and difficult to maintain. Definitely, everyone needs help and to be on one of your plans. And you said they are both accessible and affordable. I think that is key. But I envisage that we will have to bring you back at some point to delve more into those different offerings and really drill down into exactly what is offered by each different one, so that a customer is able to pick exactly a product that aligns with both their pocket and their need. So thank you very much, Mr. Mathebula. I want to move on and dwell much on the Men's Health Month. It's not a week, it's actually a month. Mr. Ngwenya, if I can ask you this next question. It is Men's Health Month. What is it all about, and why have a blue week? Or is it supposed to be a blue month?
Yes, absolutely, Mr. Bear. June is Men's Health Month, celebrated worldwide. It began in 1992 through the Men's Health Network, which was worried about the rate at which we were losing men or male counterparts living on Earth. So that brings awareness to all health issues. It is celebrated each year, dedicated to bringing the broad spectrum of national screening and educational campaigns on issues that affect men health-wise. The goal of this, the reason why it was created as a month, it has seen through studies that men were more reluctant to visit healthcare providers or doctors. In fact, a woman, the studies have proven that a woman is more likely to go 2 times to attend to a health issue compared to 0 for a man. So when the woman is going for the 3rd time, that is only when you'd see a man actually going to ask for health assistance regarding his health condition. So a study that probed the start of this awareness month was that it was discovered that actually men die 5 years earlier than women. So it was overall affecting the quality of life and male morbidity. So male mortality. So seeing that men are fewer in numbers in the world population, and now they are dying 5 years old less than men, studies have to go deep and look for what really is this cause of men dying relatively young, earlier than women. And yeah, they did the studies. We are still going to discuss all these issues that entail of this, but I was just giving you a background of how this was formed. This month gives healthcare providers as well as individuals and encourage men to seek medical advice more often than they should. And it is called a Web Blue Day. I'm surprised Mr. Perry is wearing, you didn't find your blue suit, but I saw it during the day. So thank you for being part of the Web Blue Day. It is dedicated to be this Saturday. So if you can, you should encourage your family and everyone to wear blue so that it creates awareness that a man should go seek checkup and just visit the doctor more often, just for a physical checkup, holistic. As this year's focus is regular checkups. As we have seen in the past years, they were concentrating on specific subjects. Like last year it was lung cancer and diabetes, the other year it was gout. So we've seen a rise in number of people accessing those help in male counterparts, but still we are encouraging men, as we have seen a rise in prostate cancer statistics, men just to go for a checkup, not necessarily ill, not necessarily anything wrong, just to go for a physical checkup. So our main focus is there. We wear blue and we commemorate Men's Health Day, which is this Saturday. We are already on this week, Men's Health Week, and to the whole of June, we'll be trying to raise awareness for men to seek medical attention. As the old saying always says, that prevention is better than cure. So a lot of issues that affect men can be avoided if they are diagnosed or seen earlier. Early treatment would help raise the statistic of men who are so masculine dying earlier than women. So let's encourage all of our men and all of boys to use this month. Providers are ready for us. They are encouraging men. I've seen initiatives in government hospitals that you don't even hold the line if you are a man coming for a wellness checkup in the government facilities just for this month. So I'd like to encourage all our UHI cardholders to go. All clinics are doing regular checkup for males, private or governmental. Please do go and do your regular checkup. With the United Health Card, you can actually walk into any private facility and do a full body checkup for free. Thank you, sir.
Thank you very much, Mr. Ngwenya. Hey, you know what? I actually was going to ask what is the reason that men do not like to go and have checkups, and what your opinion? I think what your opinion on that is. I think you have answered me. But it is indeed concerning that men do not want to go for checkups. So maybe a follow-up question: what are the common diseases that affect men, Mr. Ngwenya?
Okay, maybe just to add up on that one, Mr. Perry, and the viewers at home, culturally, men, I believe, a man is about masculinity, and you need to be tough, you need to be brave, you need to be self-reliant. So there are a lot of phrases in English, dear men, men up, in vernacular, indvodza ayikhali, indvodza iyaqina. So all of those cultural scripts have been embedded on us, on men, that they do not need to seek help from anyone, but rather be self-reliant. And everyone, a man of the house should protect, and a man of the house should be the person that they report to, not him going to another man in a hospital somewhere to report his problems. So it has been embedded on us culturally. Secondly, men like to analyze things from the background before they act. That is another characteristic that is general in men. Even if you go to any church, when it's time for an altar call, you'll see most women will make an immediate decision to act. But rather, men would want to consider their decision first, think about it before they act. Hence, you find that they present themselves very late in hospitals, and they don't like going there. Biologically, men are the same as women, and diseases affecting them are almost similar, except a genetic makeup of a male will obviously differ. But mostly, generally, we want to focus on this presentation. And as United Health, we want to just to take two focuses during this Men's Health Week, which are mental health and prostate cancer, which seem to be the leading problems affecting men in the Swazi society. And looking at our in-house clients on our book, UHI, we just want to concentrate on those, but there's a very large bracket of issues that affect men. But can we just specifically talk to mental health for men and prostate cancer for today?
Perfectly said, Mr. Ngwenya. Maybe as a follow-up to that, mental health is one of the issues that you have just mentioned. Why do men need to take care of their mental health? Maybe I can take this question to Mr. Sabula.
Yes.
Thank you, Mr. Bere. Indeed, the issues of mental health are a concern, and as Bongani has indicated, it is one of the key areas that we are focusing on during this Men's Health Month. It's often said that if the mind is not stable or not in a good condition, you find that then there are many other bodily functions that are affected. Hence, you find that you then tend to fall sick because you are actually not in a stable mind. So it has been shown that, or it's commonly known that both men and women do experience mental health difficulties. However, there are some notable differences between the issues affecting them and the factors that influence those issues and on how mental health and how mental health issues affect men differently. Is that probably Bongani has also touched on this, is actually the display or traditional masculine traits such as such as strength and control that men are always viewed to have due to our traditional gender roles. Issues of men being the breadwinners in the family, having to rely on themselves and not seek help from others. And actually, men, you find that they do not openly speak about their emotions. So these are some of the issues that then raises the mental health issues that then men face, which we then need to strategically deal with to ensure that men can be able to actually live longer than they actually are now. You would know, Mr. Bere, in our insurance space, especially in the life line, you find that a man would actually pay a premium which is higher than that of a lady. And it's specifically because of what Mr. Ngwenya has actually touched on, that a man would will actually go to hospital after the woman has already gone 2 times. So you can see already that the woman's health is already being taken care of, and the man is not actually attending to their health. This again is some of the reasons which emanates from the mental health, being that the man thinks if I go to hospital, I'll be viewed as a weak person, and as opposed to actually realizing that they need to actually take care of their health. So those are some of the things that then are coming or upbreeding these issues of mental health. And actually, as we are in the month of men's health, and we in this topic specifically, we are encouraging men to actually go and seek help for their mental health challenges, and actually defeat the social norms that are there in terms of what men are expected to act like or be like. They should actually want to talk to other people and actually be assisted. We can go on to some of the warning signs that someone would show when it comes to mental health challenges, or what you can look out for as you are with your colleagues or with your family members at home, and be able to pick up that they could be facing some mental health challenges that would need to be attended to. And such things would include, amongst others, Mr. Bere, aggressiveness, anger and irritability, changes in mood and energy levels of the person, changes in appetite and sleeping habits, difficulty in focusing in what they are doing. You find that they are jumping from one thing to the next. They are feeling restless and they're always on the edge, and high consumption of alcohol in some instances. It could be an indicator. And inappropriate use of drugs for others. You find that they have a heavy reliance on drugs, sleeping tablets, and many others. So all those will show that the person is actually having some mental health challenges. Some would be participating in risky activities that when you are of a sober mind, you would not really want to participate in. Some would be feeling sad, hopeless, numb, or emotionally flat. They'll be having aches, pains, physical symptoms without clear cause. Like I said, some people will be having pains that they can't really point as to where they are coming from. So this again are some of the issues that will show mental health challenges. Also obsessive or compulsive thoughts or behaviors, people thinking or acting in a way that causes concern to others or has a negative impact on their work, social or family life, and also including, Mr. Bere, one of the most common issues of where people would be even thinking of suicide. This again is one of the key or one of the most evident symptom of someone that would be actually having some mental health challenges. Obviously, again, we do say that some would actually say I'm probably not prone to mental health challenges, but we always say that, or it's said that everyone is susceptible to mental health challenges. All men are at risk. Older men at risk, men who have experienced trauma, men experiencing employment issues, men who have had a marital breakdown before, men with legal or financial concerns, men who misuse alcohol or drugs, men with family history of mental health issues is another issue, is another category of people that are actually susceptible to experiencing mental health. So those are some of the things that we've picked in regards to this topic. There are ways, Mr. Bere, in which one can be able to be assisted, which includes going for psychotherapy, going to see a physiotherapist, and being able to speak about some of the issues that are bothering you, so that you can be able to find some peace in your mind and be able to be okay. There is a medication in some instances. In some instances, you find that people need to actually change their lifestyles. For example, you need to eat a balanced diet, you should get enough sleep, exercise on most days, which is one of the things that we highly recommend and encourage on the Maswati and our clients in particular to engage in exercise, because it has been seen as one of the things that assist. When you go jogging, you find some time to clear your mind as you go around. So we do recommend that people utilize those kinds of treatment ways, including meditation or yoga for those that would be able to do that, and also limiting or avoiding the use of alcohol and drugs. It's also another way in which we can prevent this. Also, having peer support. If you realize that you have got issues, it's good that you have people that are probably in the same situation as you are, so that you can be able to speak about the issues that you are facing and be able to assist each other to overcome these issues. I am sure that you would find many of these. I think there are even organizations that will be looking into these issues that you can also touch base with, and be able to point you to people that you can be able to speak to and be assisted. And as always, Mr. Bere, we are always looking into prevention. It's always said that prevention is better than cure, and we are championing that we should all look into preventing and not find ourselves actually having these issues. So we encourage our clients and Ole Maswati to always look into how they can prevent such issues. And mental health in particular, you can be able to try and prevent using communicating with family and friends, especially when you are in stressful periods. you should be able to have that particular someone that you can speak to, be it a family member or a friend, but you must always know that if I can go to this person, they will always listen to me. They will not judge me, but they will listen to me. And if need be, they will offer assistance. But all in all, it's all about having that person that you can speak to so that you don't carry the burden all by yourself. You can seek treatment promptly if you do realize any of the symptoms that we've already spoken to, that you realize to need to attend to. Continue with maintenance treatment to prevent relapses of depression or other mental health conditions. That is if you have before been a victim of mental health challenges. Learning to manage stress through meditation, mindfulness, creative outlets, or other methods. So we encourage that people must be able to know how they can be able to manage their stresses and not let them control them, but they should control their stress, and practicing positive life choices such as eating well, sleeping enough, and exercising. Also seeing a therapist of issues such as for issues such as low self-esteem or childhood trauma, which could trigger mental health problems later in life. So these are some of the facilities or some of the ways in which you can actually deal with mental health and actually prevent yourself from getting to the point whereby you find that you now need serious attention in this. So that is, in a nutshell, Mr. Bere, what we are looking at when we speak about mental health challenges.
That is a very big nut, Mr. Mathebula, in a nutshell. So big nut. Anyway, Mr. Mathebula, when you talk of mental health, there's a tendency that somebody or people generally think of the extremes. They think when somebody says it's a mental health issue, they think you have lost your mind. You are now walking undressed in the streets or whatever, to mention the worst case, but not necessarily mental health is as simple as depression, like you have mentioned here. But tell me, how does United Health Insurance assist men with mental health issues?
Thank you, Mr. Barrett. Precisely, you have said it. That's true. That is the general view of people when you speak about mental health, of which it's a very unfortunate way in which we view these issues, because that is what mainly is preventing people from actually going out and seeking help when they are faced with these challenges. So it's something that we need to all start to embrace, that at some point we will all be exposed to having mental health challenges, and we need to confront them and ensure that we get back to our normal selves and actually be able to continue with our normal life. Which is why we, as United Health Insurance, we do offer our clients a benefit in which they will be able to go and see a psychologist. We have a contracted psychologist that they can go and see and be able to speak about whatever challenges that they are facing. So across our plans, we do have a benefit of going to see a psychologist. They will be able to speak to you and assist you with whatever challenge that you may have. Again, Mr. Bere, you find that people will say, I'll go to a psychologist, but how are they going to help me? Will they offer me the solutions that I'll be looking for? But going for those sessions is actually not for the psychologist to offer you solutions, but it is actually for you to be able to speak out whatever is in your mind, and probably they will be able to even assist you to look at things at a different perspective, so that you at the end of the day, you are able to even find the solution yourself of whatever situation that you are actually facing. So that is why we encourage that you should go speak to the person, and as you speak about the issues, you find that you get the solutions that you're looking for, and you find that the burden on yourself will be actually lifted and you are back to yourself. Thank you.
Thank you, Mr. Mathebula. Yes, you guests and viewers, you hear for yourself that United Health Insurance actually offers this service as part of the packages of the products they offer. Mr. Ngwenya, I would like to pose the next question to you. You mentioned that we would like to focus on mental health and prostate cancer. Tell us about prostate cancer, Mr. Mathebula. How does it affect men?
Okay, thank you, Mr. Perry. Firstly, it would be to encourage, to echo Mr. Mathebula's words, and in terms of human beings' mental well-being will affect the rest of the physical being. Whenever there's something not okay with your mental health, obviously all of the other organs in your body will be affected, and one of them being all the cells in the body, including which might eventually lead to cancer, because each time we are not well mentally, you affect your body's immunity, and once it is suppressed, you're living a lot of chances that are always willing to take a chance to affect your cells negatively. So please do coming back to my question, Mr. Perry. The prostate is a small organ that produces semen. It is located just under the bladder. In a male genitalia, when you see those drawings, it is just under the bladder, and its prime responsibility is to produce semen, which is obviously one of the way people reproduce. So prostate cancer would be the cancer that affects that organ, called the prostate. It is very common among men aged 65 older. Not to say it can't affect you before that, but it is most common after 65 years. Very rare before the age of 40. So that's why they encourage you from the age of 40, you start your regular yearly screening, because it is very, very manageable if it is recognized in the early stage. Prostate cancer in the early stages may not cause any symptoms, but if you let it to develop, which is the stage we do not want to reach, you might find yourself having trouble urinating, maybe decreased force of streaming the urine. In vernacular, they used to say, so when your urine will not have the proper trajectory coming out, so you'd find that there's no force when you're urinating, it just comes out. Sometimes there's blood in the urine. Sometimes when you find that there's blood in the semen, you might experience bone pain, you might lose weight, and obviously there might be erectile dysfunction because it affects, it's located in the male genitalia, and it affects them directly. So that should be the common signs of prostate cancer, but please do highlight that in the early stages, it is very asymptomatic, and hence we do encourage men to do the yearly checkups for their PSA count, especially after 40 years. Thank you.
I think if anything that affects a man's manhood really is a crucial thing to, or it's a must that you must have it checked out. Otherwise, the reason why men don't go to get checked up frequently, then that becomes a bigger problem than you thinking that you are strong and you don't want to be looked at and you think you know it all. That becomes a secondary issue. The first issue then becomes age. Because of prostate cancer being detected late and now you are unable to operate really like a man. Mr. Ngwenya, how do we prevent prostate problems or keep prostate problems in check?
We may not have an absolute prostate cancer prevention way yet, but a lot of studies and evidence shows that there are a lot of behavioral changes and dietary issues that come to play and for a healthy prostate. Though they are not absolute, but they play a very key role in keeping a prostate very healthy. First, it would be the most common that anyone can get, I believe, even on your back garden. We normally promote the eating of tomatoes. Raw tomato has an antioxidant that is called like lycopene that helps lower the risks of having prostate cancer by a very significant percentage. So each time you walk into your kitchen, just to say hi to your wife cooking, you just pick up a tomato a day and just wash it and eat it raw. That lycopene goes a long way in in keeping your prostate very healthy. Also, eating watermelon and all red foods, fruits and vegetables, those that have the red pigment normally contain lycopene. So I want to encourage, maybe I'll start a campaign next week of eating one tomato a day and keep our Swazi nation healthy. Secondly, it would be just to recognize and acknowledge eating of including fruits and vegetables as part of your meal. I know African culture taught us that once you have pap and meat, that is all you need to have a meal, which is rather creating a lot of problems health-wise for us. So eating, including fruits and green vegetables or any other vegetables for that matter, creates a good immunity for your body. And each time anything of these cancers want to start in your body, you find that your immune system is strong enough just to not let it start. So please, another key element is to recognize the power of veggies and fruit. Soybeans also have studies have shown that soybeans are linked to reducing the risks to cancer. Also, coffee grains also have an effect in lowering the risks of having prostate cancer. Smoking is very bad. Is a bad health hazard for anything, any disease in that for that matter. But it is a very high risk behavior that escalates cancers, all of them. So prostate cancer being one of them. If you smoke, you possess higher chances of developing a prostate cancer later in life. So we do encourage people to quit smoking before their bodies get damaged. Lastly, exercise. Overweight increases chances for all cancers, almost all cancers. So if you are overweight, you have a 10% more chance to develop prostate cancer. So keeping your body fit, you might walk, you might run, you might cycle, you might swim. Do something that will be a bit a bit exciting for you and not boring, so that you make it a hobby, you do it for fun. So also keeping your body weight on check will help you. Lastly would be just to talk to your doctor every year as a prevention measure and check your PSA levels and keep them on check. Those would be the ways I'd advocate that everyone watching this show and all of men out there try to engage to reduce their chances of having prostate cancer, or just to keep their prostate very healthy. Thanks.
You know what, Mr. Ngwenya? I've got a garden and there are some tomatoes that are rotting or being eaten by birds. I'm telling you, no bird is going to catch any one of them before I eat it, or none of them is going to rot because I'm going to eat it before it gets rotten. Thank you very much, Mr. Ngwenya. But one last question, and very quickly, how does UHI help men manage the issues of prostate cancer?
Okay, thank you, Mr. Berry. Definitely, I'll be coming for the tomatoes. Maybe I can have a batch for myself, because it has been my favorite fruit lately. So
yeah,
UHI has plans, flexible plans that do allow any man joining UHI to prevent cancer. Number one, to treat cancer. Number two, and to further manage cancer. Maybe if it can't be treated. Unfortunately, in cancer stages, there is a stage that would need you to be enrolled under palliative care, which is medically cannot be reversed anymore. It has progressed too much. It cannot be reversed, and it cannot be treated. And all we can do for you is treat the pain and allow you to have the best remaining life as yet, and have a peaceful good night or rest to heaven. That is the worst case about cancer. We advocate for. In UHI, under UHI policies, we have the wellness benefit that proactively assists men to screen for prostate cancer every year. Above 40, you go there with your UHI card, and you are screened, and you ensure that your cancer, if it is discovered at an early stage, it is easily treated, and it is dealt with before it becomes a problem. Secondly, UHI covers does include cancer treatments in all their plans. Should you be found to have cancer, we have oncologists in South Africa, in Mozambique, and in Botswana covered by UHI that you might be referred to when the prevention stage is surpassed, and we have to treat the cancer. So cancer is covered, so you can treat prostate cancer with our plans. Lastly, we have palliative or chronic care programs, which might help you if your cancer has progressed very very much, and there's into a point that there is no return. So we have palliative partners which you can access using your card to help you have the best remaining life as possible, should that stage be reached. But we will advocate at our utmost best that we deal with it between the prevention and screening and treatment phase. Thank you.
Thank you, Mr. Ngwenya. Thank you very much. You know what, Simphiwe? I think we needed to create 2 shows for these 2 gentlemen. They have a lot to say about this Men's Month. But yeah, I think we are already fast running out of time, Simphiwe. Any questions on your side?
You know, Mr. Bere, I would love to ask the questions, but fortunately, yes, I'm going to ask the question. It's fortunate that we are going to have the gentleman again tomorrow at 1:30, where we'll continue talking about men's health month. Our viewers can join us there. We do have a question. We do have a question from a client asking, where can I access? Can I access a United Health? Can I use United Health insurance card outside of Swaziland?
Mr. Mathebula, would you like to take that question?
Yes, thank you, Mr. Bere, and thank you for the question from our viewers. Indeed, our clients can access service in South Africa, as Bongani has already touched in terms of treating their cancer challenges. We do have contracted service providers in South Africa. Also, they have footprints in Botswana as well as in Mozambique. We know that many clients are traveling in these 3 countries, so we do have them. We do give them access there. Should it be an emergency or in a case whereby there is a referral for a particular specialist that is not in the country, we do facilitate that they be able to get assistance from there. But also, just to mention that they are welcome to walk into any Clicks outlet in South Africa. Clicks has a clinic inside, so they are able to walk into that Clicks outlet, and they will get their primary care from there, and they'll be able to come back home having been attended to in terms of their health.
Thank you, Mr. Mathebula. I think this just says how versatile the United Health medical policies are. You can get medical assistance in all these countries outside Swaziland. Simphiwe, any more questions? I'm just looking at the time with my other eye.
There is a question, however, I don't think we do not have much time about it. A client was asking about, asking Mr. Mathebula to expand on our plans that we have. Since we do have our website, I'd encourage our clients to visit our website for more information about our products offering. One last question that we have is, the client is asking if we do cover sorry, I just need to get, I'm trying to interpret the question. If we do cover if one gets into the UHI portfolio, we already with cancer, do we offer assistance immediately after, or immediately they join, or there is a waiting period for that?
Pre-existing conditions. Mr. Mathebula, would you like to cover that question again?
Thank you, Mr. Bere. Like you have actually said, we do have some waiting periods in terms of our covers that our clients would serve, depending again on how the conditions are, because as a company, Maswat, we also don't want to lose our people. So we want to take care of them. But indeed, we do have waiting periods, which as they go into the website, they will see on the brochure, we have listed the waiting periods that are there, which they will be actually falling under. And for this one in particular, being a chronic issue, I think it has a waiting period of about 6 months before they can actually be able to get assisted fully through the plan. But for a full list of the procedure of the waiting periods, they can always refer to the brochure and see. Or always they can always call us. I think Simpiwe has a toll-free line 81010 that they can always call, and they will be able to get us and be fully equipped in terms of our plans.
Thank you, Mr. Mathebula. I think, like we have said, we can't exhaust everything about United Health Insurance today. I promise that we will have Mr. Mathebula come back to discuss the health plans, the different health plans, and exactly what they offer. For today, we just wanted to touch on the Men's Health Month issues, to discuss the two issues that particularly affect men. So I am promising our viewers this. Watch this space. You will get more insight into United Health Insurance in the near future. Simpiwe, I'm going to have to insist that we need to bring it to a close now. But having said that, I'm encouraging all the viewers to please write those questions, those comments down there, keep them coming. If we are unable to answer them live on this show, you will get your response coming through your email or through your contacts. If you want to get a hold of us, just post your number there with your name in the comments. It doesn't matter what subject matter is, we will get in touch with you. We will call you back. But if you want to get a hold of us as well through our call center, we've got a toll-free number, 800-1010-800-1010. It's toll-free. You can call up and you'll be serviced there. We've got people waiting to service you from 8 to 5, but you can also just send your questions or your issues through our website, www.united.co.az. There are many forms there, each one designed for your appropriate need. Just go there, choose a form and complete it, and we'll get back to you. Simpiwe, we are about to round it off with questions and answers and prizes.
Definitely, we want the prizes, Mr. Perry. Thank you so much to our viewers for joining us today. Before, I would encourage that if you, as Mr. Perry has said, you can send through your questions. We can answer them tomorrow during our live show again at 1:30. As we close off, let me announce our winner from last week. It was Mr. Hamilton Koza, who answered our question, what is the minimum amount you can pay for legal insurance? So he gave us the correct answer just before the end of the show. So he is our winner. I am hoping our clients were listening in today, so that we have a wonderful question for this bag right here. Now this bag is quite nice, believe me. Even it's quite nice on the picture, and it's quite nice when you have it in your hands. So I hope that our clients actually were watching today to actually get this bag right here. It's quite nice. Mr. Bray, should I go on with the question or ask it first?
Just before you go on, someone might be wondering what was the correct answer from last week?
Oh, yes, definitely. You can get your legal insurance for only 50 emalangeni per month. 50 emalangeni per month, you can go get your own personal lawyer. I mean a lawyer that can say, in South Africa, they say, don't talk to me, talk to my lawyer. Right now, we are saying, get your own personal lawyer that can offer you legal advice and also represent you at in court, should there be a need to do so, from only 50 emalangeni.
Definitely, Simpiwe, just 50 malangeni. That's all it takes. Let's go ahead with today's question. I'm looking forward to this because I'm planning to use a pseudonym,
It's a wonderful thing. Definitely, the question would be wonderful. Our question for today is, give us 2 other countries except for Swaziland. You can use the UHI card and what is the procedure if you want to go to the other countries. I almost said them, but if you want to go to the other countries and use the UHI card, which are they? We have 3, not just 2, but I'm just asking for 2. Give us 2 countries and what is the procedure that you should follow when you want to go to those countries?
Hey, you know what? Me, I'm not telling them anything because I want to go to South Africa on holiday, Botswana and Mozambique, and you know, that's what I want to do.
It might just happen, you know.
Yeah.
So anytime soon, Mozambique, South Africa. Yeah, it's quite interesting that we can go outside the country just to use, and should we face an emergency, we're able to use the UHI card. Thank you, UHI. It's quite great.
Thank you, Mr. Matsebula. Thank you, Mr. Ngwenya. It has been a pleasure having you. We look forward to having you again sometime in the future. To the viewers, it has been a pleasure being your host. My name is Widen. It was a pleasure. Bye-bye.
Thank you. Have a lovely evening.
Bye.
Thank you. Bye.
Thank you, gentlemen. Thank you to our wonderful viewers. See you next week and see you tomorrow if you're able to log on at 1:30 tomorrow. Thank you.